Good morning, member of management. I'm glad I ran into you while we're waiting for the elevator. I'm working on a project that I would like to discuss with you. If you have 5 minutes or so, would you be open to having a discussion regarding healthcare associated infections? Great. I would like to talk to you about healthcare associated infections, particularly in the neonatal intensive care unit, or the NICU. So, research has shown that the NICU accounts for about 38% of healthcare associated infections in ICUs, which is a fairly large percentage. Throughout my own time as a NICU nurse, I've noticed that a lot of neonates require central lines, such as PICC lines, umbilical arterial catheters, and umbilical venous catheters for fluids, nutritional intake, and for medication administration. And because a NICU stay is typically prolonged, dependent on the baby's acuity, central lines are in place for a fairly large percentage of time. And because of that, it actually increases their chance for infection, which can also increase the baby's hospital stay. As nurses, we need to ensure we're using technological advancements um, in medicine and in informatics to our benefit for us to provide the best quality of care. So, my proposal is for NICU nurses to document on central line care bundles um, as a part in their flow sheet and regular documentation for um, neonates that have central lines rather than only certified PIC nurses to be documenting on this. Because as a bedside nurse, we are administering the medications and caring for the line, and we are visually able to see any signs of infection or anything that may occur. I think it's very crucial that as a bedside nurse, we're the ones documenting on it. And we can use informatics to modify the electronic health record to include a daily central line care maintenance checklist for central lines. So, this checklist should include different interventions that are taken by the nurse, and it should be filled out by every NICU nurse working every shift, day shift or night shift, that is caring for a patient that has a central line. And this checklist can actually be monitored or surveillanced by the PIC nurse, since the PIC nurses are certified um, in inserting the central line. However, the bedside nurse is the one that is maintaining it and ensuring that it's in the correct place by visually looking at the number on the catheter. And also, the PIC nurse can ensure that adequate care is being provided by the bedside nurses. So, if we're following this, then the PIC nurse can ensure placement by an X-ray and perform any dressing changes or follow sterile procedure per protocol or policy. And as a bedside nurse, we can further reinforce this by performing the correct interventions and documenting that we are, in fact, performing these interventions for the care of the line and the neonate. So, if nurses on every shift are performing adequate interventions and documenting on the interventions that are taken, then this will reinforce nurses to follow the correct protocol and perform adequate hand hygiene, um, and perform the necessary interventions to maintain and ensure um, an adequate line to prevent any infections to the neonate. And in return, this will reduce any increasing medical costs associated with healthcare associated infections. And it will also reduce readmissions or prolonged stays in the neonatal intensive care unit um, due to infections and infections require additional medications and other forms of therapy to help decrease the infection and also ensure the health of the neonate. So, well, it looks like our elevator is here, but thank you so much for having this discussion, and I hope that you consider some of the proposals. Thank you.